Despite several interventions being implemented to fight malaria, including the introduction of vaccines, it remains the number one cause of outpatient attendance in Ghana. According to the Ghana Health Service, 5.7 million malaria cases were recorded in 2021, with Ghana listed among the 11 countries with the highest malaria burden worldwide. The National Malaria Control Program therefore launched the National Malaria Strategic Plan in 2021 to fight the deadly disease caused by the Plasmodium parasite transmitted by the bite of an infected mosquito. The three main goals of the 5-year program are to reduce malaria mortality by 90%, reduce case incidence by 50%, and achieve malaria pre-elimination in at least 6 districts by 2025. However, speaking at the commemoration ceremony of the 2022 World Malaria Day in Hohwe, the National Malaria Control Program Manager, Dr. Kezia Mam, announced that her outfit is financially handicapped in implementing the strategic plan.
There are challenges, however. Currently, with the strategic plan, we have a gap of about $412 million for us to be able to fully implement that plan. We also need to ensure that we promote the advancements of newly proven interventions and scale it up to optimal levels. In order to achieve this, we must continue the internal resource mobilization and generation from private sector partners, donors, to augment the current resource base of the country.
The Director of Public Health at the Ghana Health Service, Dr. Franklin Esiedu Bekwe, underscored the need to focus on domestic resource mobilization.
While international funding to fight malaria is decreasing and uncertainty looms regarding the extent of future funding support, a serious obligation remains ahead all of us to intensify efforts for domestic resource mobilization. This is paramount in addressing the funding gap for IRS, SMC, and ITN campaigns and expansion of vaccination implementation. There's also a need to increase private sector involvement in the implementation of malaria control and elimination interventions.
The Deputy Minister of Health, Mahama Asei Seini, announced the government's intention to mobilize stakeholders' commitment to the malaria fight.
At current levels, malaria will cost Ghana $32 million over the next 10 years. There are ongoing engagement of key stakeholders, e.g., members of parliament, private sector organizations, civil societies, and interest groups to promote awareness and galvanize commitment that remove barriers to control and elimination.
A representative of the World Health Organization, Felicia Owusu, advocated for investment in research into drug and insecticide resistance with a focus on new strains of malaria. The Volta Regional Minister, Dr. Archibald Lecha, bemoaned the effects of malaria on the economy and called for a behavioral change to consolidate the gains in the fight against malaria.
The fight against malaria goes beyond health. It lies with also aggressively and ambitiously addressing the factors that determine health. These include, but not limited to, the following: physical and social environments, education and literacy, employment, income and social status, social support networks, and personal health practices. After having reiterated the need for multi-stakeholder involvement in the fight against malaria and demonstrating the absolute commitment of government, I will end by appealing to our sense of personal responsibility. Each one of us has a role to play to end malaria.
I call on government, political parties, political leadership, parliament, our religious leaders, civil society organizations, corporate institutions to come on board. We can do this. We need the resources. Let's commit to it. We saw what we did, everybody coming on board, contributing when it came to fighting COVID. We are not competing with COVID. We are still fighting COVID-19, but we say that if we increase our commitment, our determination, our focus, our dream to do away with malaria, come 2030, we can do it. The message is simple. Zero malaria is achievable, but it starts with you and I.
Ghana has seen a drop in malaria cases, recording 5.7 million cases in 2021 and a reduction of inpatient deaths from 599 in 2017 to 275 in 2021. Fred Kwame Asari, Joy News.